As reported by Center for Disease Control website on July 15, 2015, each year 650,000 cancer patients receive chemotherapy treatments in an outpatient oncology clinic in the United States. According to the American Cancer Society website, accessed on September 29, 2015, in 2015 alone, there will be an estimated 1,658,370 new cancer cases diagnosed and 589,430 cancer deaths in the United States. Chemo can help you fight cancer so you can live longer. To better understand chemotherapy, it is necessary to consider the types of chemotherapy treatments and how they work, the side effects, and the alternative to chemotherapy in fighting cancer. First, I will educate you on the types of chemotherapy treatments available and how they affect your body. According to WebMD website, accessed on September 30th, 2015, quote, chemotherapy, also known as chemo, is a type of cancer treatment that uses drugs to destroy cancer cells. Chemo works by stopping or slowing the growth of cancer cells, which grow and divide quickly. Chemo may be given in many different ways. You can get it in injection, intra-arterial, intraperitoneal, intravenous, topically, and orally. Now that we've discussed the different types of chemotherapy treatments and how they work, we will discuss the side effects and what they do to your body. Chemotherapy treatments not only destroy unhealthy cells, but healthy ones as well. Reported by the American Society of Clinical Oncology, accessed on September 29, 2015, the common side effects are as follows: fatigue, pain, mouth and throat sores, diarrhea, nausea and vomiting, constipation, blood disorders, nervous system effects, changes in your thinking and memory, sexual and reproductive issues, appetite loss, hair loss, and long-term side effects. I'm sure you're wondering, what is the cause of the side effects? American Society of Clinical Oncology says, quote, chemo works on active cells. Active cells are cells that are growing and dividing into more of the same type of cell. Cancer cells are active, but so are some healthy cells. These include cells in your blood, mouth, digestive system, and hair follicles. Side effects happen when chemotherapy damages these healthy cells. When you consider all the side effects caused by chemo and the fact that it really is not a cure for cancer, it makes one question if there are any other alternatives. Next, we will discuss the alternatives to chemo. When I researched methods for treating cancer, there were alternative options to chemo. The first one I discovered was several holistic treatment centers that claim nutrition plays a big part in generating healthy cells and in turn fight the cancerous cells. According to USC News website on March 30th, 2015, cancer cells rely heavily on glucose from food for energy. Changing your diet to eliminate sugars will deprive the cancer cells of growth. According to the American Cancer Society website, accessed on September 29, 2015, another alternative to chemo is radiation therapy. Radiation therapy uses high-energy particles or waves to destroy cancer cells. It is one of the most common treatments for cancer, either by itself or along with other forms of treatment. Chemotherapy is a very complex topic. At one time, I was like many people and heard the stories about chemo and its negative side effects. For all the money and time spent on the research for treating cancer, it is surprising yet disappointing that they have not found a cure for cancer. I've always referred to chemo as a poison, and sadly that is the truth. It is a poison that is given intentionally for the benefit of prolonging one's life. I've learned that while chemo is a harmful and painful treatment, it can prolong the lives of those affected. Chemotherapy has been a major form of treatment for all types of cancer, and it is used worldwide as a means that makes it possible for people to live longer. We've discussed the different types of chemo and how they work. We've also discussed the effects that chemo has on your body. Some are short-term while others are severe and permanent. Lastly, we've discussed alternatives to chemotherapy treatments. Every one of us knows of someone who has been affected directly or indirectly by cancer and experienced the hospital visits, treatments, recovery, remission, and or reached the end of a long, hard battle. I'd like to end with a tribute to my dad. He fought and lived longer than we expected because of the chemotherapy and treatments he received. Because of this, we were able to enjoy a little more time with him. In the end, the chemo gave us that chance.